This image shows a clinical thermogram of the lower extremities. On one side, we see uniform, cool colors. On the contralateral leg, there is a stark, localized high-temperature focal point near the heel, complete with a distinct numerical temperature delta. Physical therapists are accustomed to viewing the structural integrity of the body through static MRI or CT scans, but this scan captures something entirely different. It is a form of physiologic imaging. Rather than mapping anatomical damage or bone structure, it provides a real-time visualization of active biological processes. The specialized camera used to capture this scan detects the natural infrared radiation emitted by the human body, which occurs in direct proportion to its surface temperature. To interpret this data, we start with a core biological baseline, thermal symmetry. In a healthy state, contralateral regions of the body should theoretically emit identical heat signatures. When we see a localized deviation from this baseline, we call it thermal asymmetry. These distinct variations serve as immediate diagnostic indicators for underlying pathology. This functional data develops rapidly. Changes in heat emission occur long before structural damage becomes visible on a traditional X-ray. By isolating and interpreting these thermal deviations, clinicians can pinpoint subclinical inflammation, map compensatory muscle fatigue, and quantify the body's response to mechanical interventions as they happen. The thermogram acts as a direct, real-time readout of the body's functional pathophysiological state, capturing activity that standard structural imaging misses entirely. This animation shows the internal biological trigger that generates a thermal scan, starting deep within the musculoskeletal system at the site of a microinjury. When deep tissue experiences overload or inflammation, it initiates an immediate neurovascular response. This reaction is governed by the autonomic nervous system. The autonomic nervous system regulates involuntary processes, including the vascular network and internal homeostasis. A nerve pathway sends a stress signal from an injured tendon to surface capillaries, causing them to vasodilate. This pushes excess blood and heat to the skin's surface. A camera lens absorbs this radiating infrared energy, translating it into a digital grid. Because the autonomic nervous system tightly controls this vascular reaction, the resulting surface heat serves as a highly reliable proxy for deep tissue distress. This neurovascular regulation happens continuously, turning the skin surface into a live monitor of internal activity. Decoding a thermogram is the act of reading the autonomic nervous system's attempt to manage musculoskeletal dysfunction via the cutaneous microcirculation. We can observe how these biological mechanisms present in common physical rehabilitation scenarios, starting with acute inflammation. This wireframe model demonstrates localized inflammation. A tight circular hotspot appears over the knee joint, allowing therapists to pinpoint tissue overload early. Then the hotspot fades, and a broad, diffused, asymmetrical heat pattern creeps up the opposite leg, visualizing systemic compensatory fatigue. A patient may be cleared of structural damage in their primary limb, yet still experience severe pain due to invisible compensatory overloads in the contralateral limb. Thermal mapping visualizes this ischemic or fatigued muscle tissue, revealing the true, often subclinical, site of the dysfunction. Clinicians also use infrared thermography to evaluate the immediate physiological effects of therapeutic modalities, like cryotherapy or manual massage, tracking subsequent shifts in skin temperature. Thermography captures acute localized inflammation and broad compensatory fatigue before a patient reports classic clinical symptoms. Because this technology measures minute surface temperature variations, it is highly susceptible to environmental artifacts. A thermogram taken in an uncontrolled environment yields clinically useless data, necessitating strict laboratory standards for image capture. This schematic shows strict requirements. An 8x10 room maintains homogeneous temperature. Distance from the perimeter prevents radiant heat reflection from walls corrupting the scan. The floor must be insulated to prevent heat loss through the patient's feet. The image capture process is slow and meticulous, requiring the patient to fully acclimate to the room's thermodynamic baseline before imaging. Adhering to these environmental controls ensures the resulting data is reproducible and accurate. The utility of clinical thermography relies entirely on the discipline of the physical therapist. Without strict thermodynamic protocols, the physiologic data is completely compromised. In clinical practice, the workflow moves from establishing this initial baseline diagnosis to the ongoing tracking of patient rehabilitation. This diagram illustrates region of interest, or ROI, analysis, a method to isolate and quantify temperature changes in specific anatomical areas. On the baseline image, a geometric bounding box locks on to the asymmetrical heat signature to record a specific temperature value. Strict laboratory archiving practices allow clinicians to make exact overlay comparisons between these baseline images and subsequent post-treatment sessions. During the mid-treatment phase, the physical therapist uses this objective ROI data to verify if an intervention, such as therapeutic exercise or manual manipulation, is successfully reducing localized inflammation. For discharge criteria, clinicians look for a complete return to thermal symmetry. This provides an objective, data-driven biomarker indicating that the underlying pathology has resolved. This precise tracking process provides a stark contrast to traditional methods, which often rely heavily on subjective patient pain reports or delayed static imaging. Establishing this continuous, non-invasive feedback loop allows physical therapists to design highly personalized and immediately adaptable care plans. The process begins by recognizing the body's natural infrared emissions and ends by decoding the autonomic nervous system's exact response to musculoskeletal injury. When deployed with rigorous technical precision, infrared thermography serves as an objective biomarker that proves the physiological efficacy of physical rehabilitation.